EMT practice questions, emergency medical technician practice exam 35 challenging questions. Question 1. What is the first step in sizing up a scene? Determine the number of patients. Ensure scene safety. Call for backup. Put on gloves. Scene safety is always the first priority for an EMT to prevent becoming a patient themselves. Question 2. A conscious diabetic patient is confused, and you can't tell if it's hypo or hyperglycemia. You should administer for insulin, administer oral glucose, wait for ALS, check their pupil response. When in doubt, oral glucose is safer as it treats hypoglycemia and is unlikely to harm a hyperglycemic patient significantly. Question 3. What is the flow rate for a nasal cannula? 1 to 6 lpm, 10 to 15 lpm, 15 to 25 lpm, 5 to 10 lpm. Nasal cannulas are used for low-flow oxygen, typically at 1 to 6 liters per minute. Question 4. The term bradypnea refers to fast heart rate, slow heart rate, slow breathing, fast breathing. Bradypnea is an abnormally slow respiratory rate. Question 5. Which of the following is a sign of decompensated shock? Tachycardia, falling blood pressure, pale skin, anxiety. Falling blood pressure is a late sign of shock, indicating the body can no longer compensate. Question 6. How many times should a squad contact dispatch on a typical call? 3, 6, 10, 1. Standard protocol usually involves 6 contacts, en route, on scene, transporting, at hospital, clear, in quarters. Question 7. What is the first step of the primary assessment? Check pulse, general impression, check airway, determine lock. The general impression of the patient's condition is formed first upon contact. Question 8. A patient has a sharp, tearing pain between the shoulder blades and different BPS in each arm. Suspect myocardial infarction, aortic dissection, pulmonary embolism, pneumothorax. Tearing pain radiating to the back and BP discrepancy between arms are classic signs of aortic dissection. Question 9. What is the correct treatment for a mild airway obstruction in a child? Abdominal thrusts, back blows, encourage coughing and transport, blind finger sweep. If the child can cough or speak, do not interfere with their attempts to clear the airway, monitor and transport. Question 10. To assist a patient with nitroglycerin, their systolic BP must be at least 80 mmHg, 90 mmHg, 100 mmHg, 120 mmHg. Most protocols require a systolic BP 100 mmHg before administering/assisting with nitroglycerin. Question 11. A patient in tripod position with audible wheezing likely has heart attack, respiratory distress, stomach ache, seizure. The tripod position, leaning forward with hands on knees, helps optimize the use of accessory muscles for breathing. Question 12. What does BSI stand for in EMT practice? Basic system information, body substance isolation, bloodstream infection, breathing sounds intake. BSI, now often part of standard precautions, is the practice of protecting oneself from bodily fluids. Question 13. Which of the following is not part of the upper airway? Oropharynx, nasopharynx, trachea, laryngopharynx. The trachea is part of the lower airway. The airway above the vocal cords is the upper airway. Question 14. Cardiac chest pain that is felt in the jaw or left arm is called phantom pain, referred pain, localized pain, acute pain. Referred pain is pain felt in a location other than the actual source of the stimulus. Question 15. What is the golden hour in trauma care? The hour after a surgery. The ideal time to reach definitive care for best survival. The first hour of an EMT's shift. The time it takes to get to the scene. The golden hour refers to the critical window of time after a traumatic injury to reach a trauma center. Question 16. A Glasgow Coma Scale score of 3 represents minor impairment, moderate impairment, deep coma/death, full consciousness. A score of 3 is the lowest possible GCS score, indicating no response. Question 17. The proper depth of chest compressions for an adult is at least 1 inch, 2 inches, 3 inches, 4 inches. Adult compressions should be at least 2 inches, 5 centimeters, but no more than 2.4 inches, 6 centimeters. Question 18. Which organ is located in the right upper quadrant, RUQ? Spleen, liver, appendix, bladder. The liver and gallbladder are the primary organs in the RUQ. Question 19. The AVPU scale is used to assess airway, level of consciousness, vital signs, lung sounds. AVPU stands for alert, verbal, painful, and unresponsive. Question 20. Hyperventilation leads to which change in the blood? Increase in CO2, decrease in CO2, decrease in O2, increase in glucose. Hyperventilation causes excessive blowing off of carbon dioxide, leading to respiratory alkalosis.